Our heart is what keeps us going, so keeping it healthy is extremely important to avoid the risk of heart disease. Eric Stanek, Chief Medical Officer of DoctorsNow, is here for today's Hello Health. And hello, I like that you're wearing the red for the month.
had to represent, coming in at the end of February, which is National Heart Disease Month through the American Heart Association. So excited to talk a little bit more about that.
Yes, including some of the risk factors. What are some risk factors for heart disease?
So I think the first place to start when talking about heart disease is what's meant when people say heart disease, right? Because obviously the word heart disease is a large term. It encompasses a lot. What people are usually referring to is what's called atherosclerotic heart disease. It's that buildup of plaque inside the artery walls that can cause those blood vessels to narrow over time, and sometimes those clots can rupture. They form a thrombus, and that can stop blood flow to the heart, which is essentially what a heart attack is. Now, heart disease itself is a decades-long process of plaque building up over time, and so risk factor management is crucial to be able to slow down the progression of heart disease or to stop heart disease from developing at all. So there's a few risk factors that people need to keep in mind for this. The first one is chronically elevated high blood pressure, elevated lipids, lipoproteins, cholesterol, insulin resistance, high triglycerides, diabetes, elevated blood sugars. And then the last is a lot of smoking. If you smoke a pack a day, you're going to increase your risk for a lot of things, and heart disease is one of those.
And is that why this is important to have those checkups with your, your primary care provider, so you kind of know those numbers and are keeping an eye on it?
Yeah, absolutely. It's, a lot of preventative heart disease doesn't necessarily need to go through a cardiologist or a heart specialist. Those cardiologists are often taking care of people after disease has already set in, and that's challenging. We want to do what we can to prevent people from getting to that point in the first place, and most of that can be done through your primary care office. We do a blood pressure check every time you come in. That doesn't tell the whole story about your blood pressure. I usually advise people, if they've had elevated blood pressure readings in the doctor's office, make sure you have a blood pressure cuff at home so that you can monitor that, 2-3 times a week at least. A lot of people have this phenomenon of white coat hypertension. Their blood pressure is kind of artificially elevated when they come into the doctors because they're nervous. Maybe it's a new doctor. Maybe they had to sit in the waiting room a little bit too long. So keeping an eye on your blood pressure at home is important. Your lipids, your lipoproteins, your cholesterol, you can only see that with blood work. And so you can't monitor that at home. You want to make sure that you're coming in for your annual physical to get that checked. With blood sugar, there's ways for people to monitor that at home, but there's not really a way to monitor your insulin levels. And so most of that is done through an annual physical or following up with your primary care doctor as well. And then if you smoke a lot, then you want to think about quitting sometime soon. Come into your primary care doctor. We can help you to give you some helpful tips to cut back on your smoking.
What about weight? Is that something that can also be a risk factor for heart disease? And can losing it help?
Absolutely is. There's certain aspects of obesity, insulin resistance, metabolic syndrome that are risk factors for heart disease. And then there are risk factors for heart disease that are independent of obesity. And so it's good for people to know, if I am obese, what sort of risk factors can I mitigate just by improving my exercise, nutrition, sleep quality, and losing weight? And what things will require other care outside of those things? Take smoking, for example. They're independent. They're not related. So just because you're losing weight doesn't mean you're going to stop smoking, but also people who are invested in their health are probably interested in quitting smoking. A lot of elevated lipids and lipoproteins that increase your risk for heart disease, those can't necessarily be brought down with weight loss alone. A lot of times there's strong genetic components there, and so family history is important when assessing your own risk for heart disease. Now, there are other risk factors that absolutely can be mitigated by losing weight. High triglycerides, free fatty acids, those are associated strongly with insulin resistance, and having elevated levels of triglycerides for decades at a time will absolutely increase your risk for plaque buildup and developing heart disease. Blood pressure is another good example of that as well. People who are obese tend to have higher blood pressure. A lot of times they have obstructive sleep apnea, and having obstructive sleep apnea will cause your blood pressure to be high during the day, as well as increase your blood pressure while you're sleeping overnight. So by getting off some of that excess fat tissue, you can definitely increase your heart disease or mitigate your risk for heart disease in some aspects. And then there's other aspects of heart disease that weight loss doesn't necessarily address. You want to make sure that you're addressing all of your risk factors.
Well, great advice today. Of course, a good reminder, maybe we should schedule a checkup to make sure we're all on track.
Yeah, absolutely. We have primary care at Doctors Now. We have direct primary care options that doesn't require people to have insurance to come in and see us. And then we have a medical weight loss program too, where we do monitor people's blood work if they ask for it. We also monitor your body composition as well and make sure that when you're losing weight, you can do so in a healthy way that enhances your quality of life.
Well, thank you so much for joining us and wearing red today. We appreciate it.
I appreciate that. Thanks for having me.
For more information, you can go online to doctorsnow.com/medical weight loss or call 515-514-1261. You can also send any inquiries to the email address you see on your screen. You'll find them located in West Des Moines, and you can see more on social media.